Today I'm going to talk about some of the exercise I would put in an ACL prehab and some of the main coaching points and techniques for these exercises. The step up is the first exercise I prescribe for my ACL prehab. There is a number of tips and coaching points during this exercise as it is not as easy as it looks. The first one is to make sure the client is nice and close to the step up box. This ensures the weight is more focused on the front leg rather than the back leg, as a common mistake is people bounce from the back to the front. Secondly, I would make sure the movement is slow and controlled as it means that the weight transfer from the back to the front is more emphasised. If you found your client was bouncing from the back leg to the front leg, a tip you could give them is to lift their toes off the floor. This would reduce the amount of weight that they can push up through, thus increasing the amount of weight going through the front leg. This is good in an ACL prehab setting as it increases the load on a single knee if you were to focus on one leg, whereas other exercises can often focus on both legs. If you would like to increase the difficulty of this exercise, you could use weights either as a dumbbell or a bag. Also, if you wanted to reduce the difficulty, you could use a smaller box. The second exercise I prescribe for an ACL prehab is a squat. There is a number of issues and coaching points with the squat which I will discuss. The first issue is that the knees can cave in on the push-up phase. This can occur due to a number of reasons. The first one is lack of hip strength and awareness. To improve this, you could use a resistance band and pull outwards on the knee that comes in, or secondly, you could put a resistance band around both the legs and push outwards to improve hip awareness and also improve strength at the same time. The second issue is that the core could not be engaged. For this you would see a bit of a rounded back. For this you would tell them to engage the tense of the core prior to performing the squat. Also, a curved back can often occur when squatting, which is a major issue as it increases the amount of force going through the lower spine and can cause injuries like disc herniations. To combat this, you could tell your client to try and extend their back and engage their core at the same time before squatting. When squatting, one of the coaching points we are looking for is the chest and hips to rise at the same time. This ensures the barbell is going up in a straight line and is good technique. This is good for an ACL prehab because it improves the strength of the hamstrings and quadriceps both eccentrically and concentrically. If you wanted to make this harder, you could increase the weight of the barbell. The third exercise I would put in my ACL prehab is a lunge on a Bosey ball. The first coaching point is to make sure the client is facing forwards with their core engaged. This keeps the back in a neutral position and prevents any rounding that may occur, and also moves the body weight effectively. Secondly, we are looking to keep the hips level during this movement. If the hips were to drop, it would suggest a weakness of the hip stabilizers, which we could work on in later sessions. We also want to try and keep the knee as straight as possible, or even though we are working on a Bosey ball, which causes instability on that leg, we want to try and keep the knee facing forwards and preventing it from caving inwards. We are also looking for a 90-degree angle on the back leg, which will ensure we are getting the correct depth in the lunge. This exercise is really good for an ACL prehab as it works on strength of the hamstring and quadriceps, but also works proprioception of the knee and ankle joint. If you wanted to make this harder, you could add weights by using dumbbells on either side, but also if it was too hard with your client, you could remove the Bosey ball. Glute bridge on heels is the fourth exercise I would use for ACL prehab. When prescribing this exercise, one coaching point would be to keep the core engaged throughout the exercise. This ensures the spine and the torso stay flat when pushing upwards. Secondly, you would ask your client to make sure their heels are pushed firmly into the ground, which as a result increases the muscle activation of the hamstrings. To reinforce this, you could ask your client to lift their feet off the floor, meaning only their heels are in contact with the ground. When your client is pushing up, you would suggest that from their knees all the way down to their shoulders is a straight line. This would prevent any potential hyperextension which may occur due to the client pushing up too much. This exercise is good for ACL prehab as it targets the hamstring more so than any other exercise, which researchers suggested protect the ACL due to the insertions of semitendinosus and semimembranosus.